Hi, I'm 𝗲𝗄𝗿 𝗟𝗶. Thanks for being here. The reason why I'm doing this today is so that more people do not get scammed, calling numbers that they don't really know who they're calling, and getting tricked into buying a plan that they maybe shouldn't buy. It's important that I go through some of my background just so you can understand the context and why this fires me up so much. First of all, when I was 19 years old, I became a police officer. I really wanted to protect people from bad guys. Just really all I wanted to do. During the course of being a police officer for, was it 15 years total? Or 20, I can't remember. I got an associate's degree in criminal justice, no big deal, a bachelor's degree, then went to military police school in Anniston, Alabama, in the Army. That was a lot of fun. Then went to work for the volusia County Sheriff's Office in Daytona Beach. While there, I started with patrol, the courthouse, and then went to community relations, which I really enjoyed. And part of that job was going through the Attorney General School for fraud and being able to communicate with people what they should do to avoid getting defrauded. And when I did that, I then got promoted to sergeant and then went from that into CID. And in CID is where we would investigate crimes, many of which were fraud. And then I enjoyed going back into community relations and being able to share this information of things that we'd learned in crime to avoid other people getting ripped off. And that's what I really enjoyed doing in most of my career. What I'm talking about today is where our two lives, my two lives, overlap. And that is where we have some people trying to trick people into getting plans and to make more money when they're just being deceptive about it. What is a scam? A scam is something that's just dishonest. It's a scheme. And you'll see what I'm going to show you today is what some of my fellow agents out there in the insurance world are doing. It is a dadgum scheme. And here's what it is. Okay, this is my company, Senior Savings Network. We're coast to coast and we help people with Medicare plans. That's not the important thing. The important thing is, look, here's our phone number. Our phone number is 800-729-9590. However, what these scammers are doing is they're taking my phone number and switching just a couple of numbers that some people are likely to get potentially wrong. They switch the middle numbers. And we had a client call the other day and tell us this is what's happening, and they got pitched into a Medicare pitch by somebody who's a complete rando. But it's not just me and my agency that's affected. I looked at some of my other friends in the industry. Boomer Benefits. Danielle is an amazing agent, runs a very successful agency there and really takes care of her people. But look what they're doing. Her phone number starts with 855. And so these scammers have taken over the 800 number. Now, who knows how much they had to pay to get this vanity number? Because usually they just give you a random number. But they specifically targeted her agency in order to siphon off people who are trying to call her for legitimate help. And when you call that number, and you can do it if you want to. Here's the number right there on the screen. If you call that number, it'll ask you if you want a medical alert bracelet for free. And if you say no, then it's going to give you a Medicare pitch and switch you into a Medicare agency. But I'm going to go deeper. This is another friend of mine, Medicare FAQ, 𝗲𝗂𝗍. Jagger and David run an excellent organization out of Florida. They're a nationwide Medicare shop called Elite Insurance Partners. Their phone number, just like mine, was switched in the middle. And by doing that, I'm going to take you down this rabbit hole and you're going to see what they do when you call this number. Now, I posed as a hypothetical person because I had no idea who I was going to get on the phone. I literally just switched these numbers, didn't try a whole bunch of different numbers. I just switched what a common person would do by accident. And I got this. I'll be back on the other side to talk about this.
We're on a recorded line.
Hi, I have Mike Roch on the line with us.
We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area.
Wow.
Please contact Medicare.gov or 1-800-Medicare to get information on all of your options.
Hi, I have Mike Roch on the line with us. Zip code 72756. Date of birth is 12/7/1954. They're interested in shopping for Medicare quotes today. Mike Roch, thank you for calling. It's been my pleasure. You both have a great day.
All right. Now, I do believe you got transferred over to me today to look into your Medicare options, correct?
Yeah, I was trying to reach Elite Insurance Partners. And is that affiliated with you?
Elite Insurance Partners?
Yeah.
Not quite. The company that I work with is SelectQuote. Okay? Your zip code was 72756, correct?
Yeah, in Rogers.
Here we are on a recorded line, and I am a licensed sales agent in the state of Arkansas. Now, I do believe you got transferred over to me today to look into your Medicare options. Is this correct?
Yeah, I believe so. Yeah.
All right. Well, I'm glad to help. And I'm guessing you do have parts A and B of original Medicare. Is that correct?
Yes.
what do you have to go along with that? Do you have maybe an Advantage plan or a supplement plan?
Nothing yet.
Nothing yet. Okay. So let's go ahead and see what we can do for you today. Now, once again, the company that I work with, SelectQuote, we are one of the largest Medicare advisory firms, and we do work with the top-rated carriers. Okay? Now, let me ask you a couple questions since you don't have anything quite yet, just to make sure that we do find the right kind of coverage for you. Okay? Are you currently seeing any specialists?
No.
Okay. And when you go to your primary care physician, are you paying any copays there?
Yes, actually.
What are you paying when you go to your primary care physician?
I think it's 20% of the bill.
20% of the bill. Okay. That's just with original Medicare right there. That's pretty standard with that. When was the last time that you had your vision or hearing checked?
Oh gosh, I don't know.
You wear glasses?
Yes.
What did you pay for your glasses the last time you picked them up?
Oh, I think $300 or so.
$300 or so. Okay. When was the last time you went into a dental office?
Oh, usually go once a year. Probably been about a year.
Once a year? And what was the last thing that you had done in a dental office?
Just a regular routine checkup.
Routine checkup. Okay. And are you in need of any dental work currently?
No.
Okay. Do you take any vitamins or supplements?
Oh, sure. Yeah. Just vitamins.
Okay. And are you paying for those out of your pocket?
Yeah. Mm-hmm.
Okay. Now I do see we do have a few special enrollment periods for you. And let me just double check a few of these different carriers. I do see a couple carriers that do have some declared emergencies for your state.
Emergency.
I haven't quite looked your report up yet. I'm going to do that here in just a few moments. But because you don't have any kind of coverage with you, the annual enrollment period usually runs between October 15th through December 7th. And that is the point in time that everybody, the general population, is able to make changes to their plan for their insurance. Now, anytime outside of that date period from October 15th through December 7th, we have to find a special enrollment period for you. Unless you're in your initial coverage period, which means that your parts A and B just started. Okay? So I'm just, looking up a few things to see if we do have any carriers that do have, let's say, a FEMA declared emergency. And with that, I have found one. I'm going to continue searching and just double check if you understand what I mean, because it's always good to have more than one that we can look at.
So one insurance company has an emergency, but the other ones don't?
Well, the way they do it is FEMA declares the emergency.
Right.
Okay? And the carriers will either accept that emergency as a special enrollment period if you were in an area that was affected by it and it stopped you from being able to use, let's say, the annual enrollment period. The carrier will let you make up that specific enrollment period. Okay? And since we just passed the annual enrollment period last year, at December 7th was the last time to enroll for the annual enrollment period, we're going to be looking for carriers that have either, and there's a couple of different special enrollment periods. We could use a 5-star enrollment period if we found a 5-star plan for you. That does give you a special enrollment period. There are various others, but I just like to start by looking at things and seeing what we might be able to do for you, okay?
Okay.
So right now I do see we do have a carrier that does have a special enrollment period, and it's been on the books for a little while. So I'm more than likely going to use that unless you're in your initial enrollment period. So,
and what company is that?
I'm putting down over the counter. It's with Humana.
Okay.
Okay. Humana has a special enrollment period at this point. There might be others, okay? I'm going to keep an eye out as we continue on, and I'm going to take a look at what you do have for eligibility here in just a moment. Now, do you drive?
Yeah. Mm-hmm.
Okay. Just ask that question of all my clients, because some of my clients, they don't drive. And if they don't drive, I like to make sure they're still able to get to and from their doctor's appointments. Do you have any upcoming surgeries or medical procedures planned for this year?
No. Very healthy.
Okay. Is there anything that you'd like to see a carrier cover for you? I've already got down coverage for glasses, coverage for dental, and some over-the-counter benefits that we're going to be trying to find in a plan. Is there anything else you'd like to see in a plan cover for you that you'd like me to look for?
Just the doctors and the hospital if I need it.
Okay. I'm going to collect a list of your doctor's names and prescriptions that you're currently taking to make sure that we get those covered through any carrier if you're taking any prescriptions, but I'm definitely going to collect that list of doctors here in just a minute. Now, first thing that I'd like to do, I'd like to look your information up on our national database. Do you have your Medicare ID card? Could you grab that for me?
Okay, it'll take me a minute to get that.
Okay.
And you can look up my Medicare record already?
That's what we're going to do with your Medicare ID number.
Neat. Okay. Well, can you tell me what the emergency is that that would allow me to get a plan?
It was a tornado and severe weather.
Oh. Okay. I never heard of that when I was looking at the Medicare supplements that are out there. Now, would this be like a Plan G that I've been saying about, or a different plan?
No. What we're looking at right now, here's the thing. With the supplement plan, to enroll into a supplement plan, if you're past your initial enrollment period, and they give you, I believe, 6 months time window from your initial enrollment period to get onto a supplement plan without having to pass underwriting. If you've passed that period, then you would have to pass medical underwriting to join a supplement plan. We can look into supplement plans as well. And with supplement plans, you'd have to find a prescription drug plan to go along with that. Now, an Advantage plan, it works very similarly, but a little bit different, okay? Now, with original Medicare, it's an 80-20% co-insurance. You already understand because you're paying 20% for your primary care physician. With that, the supplement plan usually covers the other 20%, but you pay a premium every month for the supplement, okay? And you pay your Part B premium, so Medicare covers their 80%, and then you pay the premium to the supplement plan, so they'll cover the other 20%. With that, there's usually no additional benefits associated with the supplement plan aside from maybe a gym membership, okay? Because they only cover what original Medicare covers. Now, an Advantage plan, we can find those for you, and this is why I was talking about special enrollment periods, okay? Because with the supplement plan, you need to pass underwriting, which is a series of questions that they ask you to make sure that the risk is worth it, okay? Some carriers will not, accept the client as a supplement plan enrollee if you've had prior conditions, okay? Because they're looking at the costs that they're going to be paying out, and if the premium that they have and are able to collect is going to cover those, okay? But you're saying you're relatively healthy, so you might be able to pass, the underwriting, and we're going to look into that. But first thing that I'd like to do, I'd just like to pull up a report from Medicare that shows me your eligibility. It shows me a few other things like your Parts A and B start date, any low-income subsidies that you might have, okay? Do you have your Medicare ID card?
No, I'm just not willing to give out my Medicare number to somebody I don't know on the phone just quite yet. And I'm just confused about why would I not want a Medicare supplement? I'm confused there.
Not that you wouldn't want a Medicare supplement, okay? But what I was talking about before with all the additional benefits was part of an Advantage plan, okay? When I started asking questions, I was looking into seeing which Advantage plan would be the best choice for you.
Right.
Now, you're looking into supplement plans, and you were talking about a Plan G, is that correct?
Well, yeah, I was just wondering why you never brought it up, or just looking at Advantage plans only. I was just wondering why.
Well, usually when I bring this up, I start with an Advantage plan unless somebody asks for a supplement plan specifically, because the Advantage plans usually have a lot less of a premium, okay? And oftentimes, a lot of my clients don't like high premiums that are associated with the supplement plans, because with an Advantage plan, Medicare collects that Part B premium, and instead of providing you your benefits when you join with an Advantage plan, what they do is they send part of that Part B premium over to the Advantage plan to cover your medical expenses, okay? And with these Advantage plans, the larger amount of enrollees they have, the better the benefits are, because they're able to spread their costs over a larger group of people. And with that, they're able to offer you more benefits because they're able to effectively manage their costs. So they pass that savings on to you, oftentimes through additional benefits like the dental division, the hearing, over-the-counter benefits, and usually because they're collecting that premium, the Part B premium from Medicare, they have lower or almost no premiums, okay? We're looking at a very big range of premiums, and it depends on what plan you're looking for, okay, with the supplement versus the Advantage plan.
Okay, so you're assuming that I want no premium, and that's why we only talked about Advantage plans. So my question is, on the supplements, I can go to any doctor in the country. Can I do the same thing with an Advantage plan?
Now, with an Advantage plan, it depends on what kind of plan we find for you. HMO plans, they have a network of doctors, and the way they keep their costs low is these doctors are doctors that they have contracts with. And for them to keep their costs low, they expect for you to stay inside of that network of doctors. If you go outside of the network of doctors, they don't cover those doctors. I've only found that a carrier that has a special enrollment period, okay? It's an Advantage plan. It would be an Advantage plan if they have plans available in your county. Plans are offered county by county, okay? And like I was saying, I can take a look into seeing if we have anything available in that area.
So just to clarify, if I go outside of if I have to go outside of the network on an HMO plan, and I need to go to a specialist that is not in the network for this Humana plan, what happens then? Do I pay my 20% like I do right now?
If it's an HMO plan, okay, the way HMOs work is with an HMO plan, when you find an in-network doctor, and we're going to find you an in-network doctor for your primary care, make sure that they're in-network. If your doctor that you're currently seeing is in-network, then what they do is they try and keep you in-network with the doctors that you would see, okay? Now, if we find you the PPO plan, then the PPO plan, like I said, it offers you the ability to see doctors that are both in and out of network. But if you were trying to see a doctor that is not in network, okay, you would have to cover that doctor yourself. They wouldn't offer you any coverage for that doctor.
Like 100% of the cost?
Yes.
Okay. And that's why I was looking at a Medicare supplement, because I don't have a restriction of a network. Can you tell me what those cost?
Okay. Like I was saying, to go any further, I do have to check your eligibility. Now,
you can't tell me what the supplements cost without my card? I'm confused.
Like I said, the company that I work with, we have a process, and I have to check your eligibility to go on past that page and get into the quote engine.
Wow.
Okay, you can always look things up on Medicare.gov, and they'd be able to show you all the things that are available in your area. Okay, but if you don't feel comfortable providing your Medicare ID number, that's perfectly fine. I understand. You really don't know me at all. So my suggestion, if you don't want to provide that number, go ahead and go on Medicare.com and look up the ability for you, okay?
Oh, okay. So I can get my Plan G through Medicare.gov?
You can look up on Medicare.gov and see what plans are available. Maybe contact one of the carriers on Medicare.gov.
Okay, so you'd rather me go through an insurance company direct than be able to help me with a Plan G?
Well, like I said, I can look into the plans available in your area, but to get into the quote engine, I do need to look your information up on the national database.
Okay,
which means
I don't know what an
that
engine
Medicare
is.
ID number is
I'm just
something-
wondering where I can get rates without having to go to an insurance company myself, but you can't do that without going through this engine?
Right.
Oh, that's too bad.
Okay, but you're saying you're relatively healthy, so you might be able to pass, the underwriting, and we're going to look into that. But first thing that I'd like to do, I'd just like to pull up a report. Well, I do appreciate your time today. Thank you there, and I hope you have a wonderful day, okay?
All right, sorry I can't buy an Advantage plan from you today. Take care. You know, what was interesting to note is he never once asked me when I started on Medicare or when I started Part B. I could have left my employer 30 days ago, and I'm still in an open enrollment period. Never bothered to ask. He just wanted to go through his pitch, told me that he would help me with a Medicare supplement because I clearly did more research than he was allowing for. And then, no, that's not good enough. Going to shove me into Medicare Advantage. And if I don't want a Medicare Advantage plan, go pound sand and go to Medicare directly. Horrible representation of what an agent should do in this industry. Anyway, I just want to let you know what's going on out there. If you want to use our company for getting your Medicare plan, I promise you one thing, we'll actually be listening to you. We won't just be pushing you into our agenda. Here's how you can contact us. You can reach out to that number or the website 24 hours a day. We have no agenda. I'm not going to predispose you to what type of plan, what plan letter or whatever. We're going to listen to you. That's a novel concept. And the other people that I mentioned in this video at the very beginning, those are legitimate people too, but make sure you're calling the actual phone number. If something doesn't sound right, or if somebody calls you on the phone to try to pitch you into a plan, just say no and hang up. Never, never, never give out your Medicare number to somebody who called you first on the phone. You have to know who you called. If there's anything we can do to help you, please reach out. We're here to do just that. God bless you. Thanks for watching.